Well, first it was children's pain relievers, Tylenol, Advil. Now it's the commonly used antibiotic amoxicillin that is becoming impossible to find. Parents with sick little ones are running out of options when it comes to caring for them at home, and instead, they're being forced to go to the hospital. What is behind the shortage, and what should you do if your child gets sick? For that, we turn to Chief Pharmacist Officer with the Canadian Pharmacists Association, Danielle Pace. Welcome to Your Morning.
Good morning. Thank you for having me.
Listen, this is a discussion you and I are going to have, is the discussion that every parent I know is having right now. First of all, what are you seeing on the ground? Where are the shortages felt the most acutely?
So right now, pharmacists across the country are managing two high-profile shortages, the first being the children's Tylenol and Advil, so acetaminophen and ibuprofen products, and most recently, amoxicillin, which is an antibiotic used to treat infections. So we're starting to see that that's hitting the pharmacy level. We're hoping that with proper management over the next couple months, we'll be able to make our way through. We're hearing that supplies will start to come in January, as early as January. And so over the next couple months, do our best to manage what we have on hand.
January seems like a long ways off, and I mean, I'm sure you've seen the pictures that I'm seeing on social media. Parents emailing each other, empty shelves everywhere, other parents reaching out. You know, some people we know are mailing medicine from across the country. What is behind this shortage? Was it not enough ordering? Is there a supply issue somewhere? Is it ingredients? What is it?
Well, you know, when it comes to the pain and fever medication shortage, we know that that was largely driven by demand. We had a really rough season with the viruses starting as early as the summer and working into their fall, and we're living it right now. And you know, these are over-the-counter products, so they're easily accessible. You're able to go in and pick them up off the shelves. People may have been purchasing more than they needed, which added strain to the supply. When it comes to the amoxicillin shortage, it's not as straightforward. It's a prescription product, so you would need to be assessed by a healthcare professional and get a prescription. However, we know that there's been a lot of virus activity. It's affecting our children across the country. And while antibiotics aren't used to treat viruses specifically, so they're not effective in flu and cold, they can an agent used to treat complications from viral infections, so chest infections, respiratory infections, and so that's the correlation there. It seems like there may be a link to demand in this situation as well.
I want to ask you about compounding pharmacies. This is a kind of pharmacy not every parent knows about. How can they play a role in alleviating the need?
So compounding pharmacies, it's an option, definitely a solution if you are able to access the raw ingredients. So compounding is the process of making the medication from scratch. However, it's not available at all pharmacies. It takes time to prepare the products, and they can be costly. So while it is an option, it's not going to be the go-to solutions. That said, pharmacies are all pharmacies have a role to play in managing the shortage. Your pharmacist is the medication expert. We do this every day. You know, we work with prescribers in the event that patients have allergies or if there's a drug interaction. We're very well versed at finding alternatives and coming up with problem-solving strategies to make sure that patients get the medications that they need and that are going to be effective for them.
Can you share some of those with us? Because right now parents are stuck in this loop where they have a child at home, they'd like to treat them at home because the hospital is saying we can't take you in emerge right now, only the most sick need to be there, but the medicine for them to treat them at home isn't there. So what can they do?
So, you know, in this situation, definitely going to the pharmacy is your best bet, and seeing what's available to your in your pharmacy. So whether or not if you have a prescription for amoxicillin, it's possible that the pharmacy may have supply. If they don't, the pharmacist will work with you to ensure that there's an alternative available. So whether or not that's a different formulation, these medications are available in oral liquid suspensions, in tablets, in capsules. And so we can get creative with the different doses that are available. It might look different than a product that you're typically used to seeing, but there are options. So that's the good thing about these being common medications, is we have solutions available.
All right,
the
Danielle,
other thing I The other thing I will say is that, prevention goes a long way. We're seeing the spread of virus activity across the country. Make sure your kids up to date with their flu shot and their COVID boosters. And then hand hygiene, masking, social distancing, these have all helped us throughout the pandemic. And this is a really great time for us to do whatever we can to protect ourselves and our communities.
Yeah, it is a frustrating time, though, for parents who have kids who are, back at school and sick at home, and wanting to be back at school but sick at home. Danielle, thanks for your time this morning.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.